Bruxism, clenching and grinding. This is one of the most common symptoms that we see in our patients with myofunctional impairment. And it's interesting because we used to think that it was just stress, right? You have a stressful day, you're going to clench and grind at night. And now we're finding that that is not the case, or at least that's not the whole story, right? Stress is important to monitor. We want to deal with that. But what we want to do is find the underlying root cause. And what we're actually learning is that it can be due to a compromised airway and sleep disordered breathing. So this could be a naturally small airway. It can be due to improper growth and development. You might have a blockage, so large tonsils or adenoids, especially in kids. We want to pay attention to that. And then for adults, we're looking at everything from snoring all the way through to obstructive sleep apnea. What happens when you have sleep disordered breathing, when you have any type of blockage affecting the airway, the body's going to do everything possible to keep that airway open. That's its number one goal, is to keep you breathing. So at night, if that tongue is falling back into the airway, or if the muscles of the throat are weak or flaccid and they're closing down while you're sleeping, that is something that it needs to correct. And so it is going to clench those teeth together. It's going to push that lower jaw forward to try and pull the tongue out of the airway or open that airway. And that can go on all night long. So if you're having clenching and grinding symptoms, look at your airway, look at your breathing, get a sleep study done.